Hello friends, welcome back to our channel IAS Help Desk. Today we are going to discuss about Ayushmaan Bharat Yojana, and this topic is important from mains perspective, especially GS paper 2, where we study about the government schemes and different policies for the vulnerable sections. Also, we are going to analyze one or two some previous year questions just to have an idea that how we can approach towards such kind of government schemes and topics. So let's begin our discussion. So these are the aspects that we are going to cover during our discussion. So firstly, we'll be seeing that is what is Ayushmaan Bharat Yojana, components of the scheme, along with who are the beneficiaries of this scheme, why it was launched, what is the current status of the scheme, and what is the possible challenges that what are the possible and in fact what are the present challenges that the government is facing right now in the implementation of the scheme, along with the solutions and the way forward. So firstly, let's see what is Ayushmaan Bharat Yojana. So Ayushmaan Bharat, a flagship scheme of Government of India, it was launched as recommended by the National Health Policy 2017 to achieve the vision of universal health coverage. So what is flagship scheme? Flagship scheme का मतलब होता है those government schemes which are most important and schemes that address major national concerns like schemes on health, education, environment, etc. So we can say that government जब किसी scheme को priority देती है to achieve certain social objective, it is called as flagship scheme. And so this Ayushman Bharat Yojana, it was recommended by National Health Policy in 2017 in the context of achieving universal health coverage. Now, universal health coverage क्या है? इसका मतलब क्या है? So, when all people will have the access to the full range of quality health services that they need without any financial hardships. यानी कि सभी सिटीजन्स के पास जब एक क्वालिटी यानी कि बेहतर हेल्थ केयर सर्विसेज उनके पास मौजूद होंगी, और वो भी तब जबकि उनके बजट पर, उनके पॉकेट पर, उनके पर्स पे बहुत ज़्यादा बर्डन ना पड़े. And now let's see what are the different components of this योजना. So components का मतलब होता है कि what are the different parts or what is a scheme is comprising of. So the first component of this yojana is health and wellness centers. So creation of health and wellness centers by transforming the existing sub-centers and primary health centers. And then deliver comprehensive primary health care. Comprehensive कहने का मतलब है कि having a complete approach, complete यानी कि not only during the treatment, also from the process of preventing the disease or any illness to the person from after being cured, यानी कि ठीक होने के बाद भी उसके इंश्योरेंस से रिलेटेड या फिर उसके बाकी मेंटल हेल्थ सर्विसेज हो गए बाद में और पहले भी. So mental health services as a preventive measures भी आता है. So giving a holistic approach to healthcare services. And then cover maternal and child health services and non-communicable diseases, including free essential drugs and diagnostic services. So this was component 1. And then component 2, it comprises of Pradhan Mantri Jan Arogya Yojana. So this provides a cover of 5 lakh per family per year for secondary and tertiary care hospitalization across public and private empaneled hospitals in India. So it is largest government funded, in fact it is one of the largest government funded health insurance scheme in the world. So the scheme offers eligible families an insurance cover of rupees 5 lakh per annum per family. Also, the amount is intended to cover all secondary and most tertiary care expenditures that is incurred. Also, there is no cap on family size and age under the scheme to ensure that nobody is left behind. So the cover will include pre and post hospitalization expenses, and it will also cover all pre-existing conditions. And along with all these things, the beneficiary will also receive a defined transport allowance per hospital. And the beneficiaries, they can take the cashless treatment from any empaneled hospital anywhere in the country. And this includes both public and private hospitals, as we have seen. So by default, all government hospitals in the states that are implementing the scheme will be empaneled. So, who all are the beneficiaries as per this Ayushman Bharat Yojana? So, they are economically vulnerable sections of society, including deprived rural families and identified occupational categories of urban workers' families. And now let's see the different aspect of this Yojana, that what was the need, that why Ayushman Bharat scheme was launched. So as per Health Financing Profile 2017 by World Health Organization, the healthcare out of pocket expenditure in India was estimated at approximately 67.78% of the total health expenditure, which is higher than the world average of 18.2%, indicating a high expenditure which leads to the high incidence of catastrophic expenditures and inequality. So, depending on the level of care required, healthcare in India is broadly classified into primary care, secondary, and tertiary healthcare. So, the high level group on health sector and the report of 15th Finance Commission on Ayushman Bharat, that have observed that focus on prevention and early management of health problems can reduce the need for complicated specialist care provided at the tertiary level. So it recommended that the focus of healthcare provision in the country should be towards providing the primary healthcare. Further, the National Health Policy 2017, it indicated that the need to increase public healthcare spending in India is high, because it's due to the rising demand for healthcare infrastructure and services, and also out of pocket expenditure. So, to improve the public's access to health services and meet the rising demand for healthcare infrastructure and services, the government introduced this Ayushman Bharat scheme. So, Pradhan Mantri Jan Arogya Yojana, it can probably be helpful for chronically ill patients from lower socioeconomic strata requiring frequent hospitalization or expensive procedures such as dialysis. And also, it can incentivize the existing secondary and tertiary care public health facilities by infusing more insurance claim money. So, in the long run, of course, the scheme has the potential to enable the growth of the private sector in second and third tier cities, thus giving a rural Indian people having more choices. Now, let's see the other aspect of the scheme, that how the scheme has progressed till now, or how the scheme is doing in its current status. So, with the launch of this Ayushman Bharat scheme, it has been the most extensive government funded healthcare scheme and catering to the medical needs of lakhs of people in the country. So, the scheme has proved to be the most effective healthcare scheme, and it also aligns with the Sustainable Development Goals. So, thereby contributing to the welfare of the entire country. And as we saw, it has two components like health and wellness centers along with Pradhan Mantri Jan Arogya Yojana. So, these two components, they are doing well enough for the welfare of the vulnerable sections. Also, here are some data that we have provided which can make your answer look more authentic, and that can give an edge to your answer. So let's see the last point that has been mentioned here, that under the e-Sanjeevani teleconsultation platform, more than 9.3 crore teleconsultations have been provided through functional health centers at this hubs, and it comprises of certain and certain spokes and numbers across the country, and it was on 17th of January 2023. So basically, I just wanted to give you a brief about what is teleconsultation. So teleconsultation, it is one of the application of telemedicine, and it uses IT to facilitate communications between a patient and a doctor who are otherwise geographically separated. So, what is telemedicine now? As per WHO defines, so telemedicine is the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information technology for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, etc. So, these all in the interest of advancing the health of individual and their communities. So, all these aspects it has added it has added to the progress of Ayushman Bharat Yojana. Now, let's look into the aspect that what are the challenges in implementation of this scheme. So, the first would be the decentralized and inequitable implementation. So, by this we mean that while Pradhan Mantri Jan Arogya Yojana is a national initiative, its implementation is fully delegated to the states and with no overreaching mechanism to address the resource gaps. So, the Pradhan Mantri Jan Arogya Yojana, its enrollment and service utilization are concentrated in wealthier states only, while the poorer states are left behind. And then the next one is unbalanced provider quality and empanelment. And by this we mean that the lack of public infrastructure and low quality public health care that have been long standing problems in India. So, according to the recent study that has been seen, the number of private hospitals in health insurance network in Bihar has 253, whereas in contrast in Maharashtra it's more than 3000 private hospitals in the network. So, under Pradhan Mantri Jan Arogya Yojana, states are with higher poverty rates and disease burden see less empanelment and accreditation of hospitals. And the next challenge is portability. So, Pradhan Mantri Jan Arogya Yojana it allows portability of benefits across the states. So, the relatively better treatment facilities available in the better performing states of the country are likely to attract more patients from states with inadequate facilities. And then the lack of resources. So the country is beset with deficiencies in the resources available to fund healthcare. The skilled workforce and the infrastructure available to provide care and oversight of healthcare provision. Also, the private providers have become the dominant provider of care in India, and thus the UHC is unlikely to be achieved without engagement with this sector. UHC means that universal health coverage. So the profit motive that drives the behavior of these providers, however, has led to the concerns that services may be encouraged to sometimes that act against the public interest. And then we have poor regulation on private hospitals. So the regulation and oversight of private providers in our country is often poor. So the private providers more frequently deviate from the evidence-based practice and they have poorer patient outcomes and are more likely to provide unnecessary testings and treatment. And also the data that do exist from India have mirrored these findings. So these can be substantiated. Also, the corruptions at all levels of the system, from doctor training of investment to investment decisions, remains a major issue. Then the next major challenge is poor budgetary allocation. So the amount allocated to Pradhan Mantri Jan Arogya Yojana in two subsequent annual budgets is also proportionately much lower to cover the targeted 40% of the population of the country. And by saying this two subsequent annual budget, we mean that 2018-19 till 2019-20. So, all these weaknesses pose a threat to the ability of proposed reforms to meet their ambitious objectives by providing the impetus for like systematic reforms. Uh, this scheme it presents the nation with a chance to tackle long-term and embedded shortcomings in governance, quality control, and stewardship. So now let's see what are the steps needed for the improvement of the schemes. So, to improve the Ayushman Bharat scheme in India, several steps can be taken, and here are some recommendations in which first is enhanced awareness and outreach. So, conducting extensive awareness campaigns to educate people about the benefits and coverage of the Ayushman Bharat scheme. So, this can be one of the step. And also utilizing multiple communication channels, including mass media, social media, and community engagement programs to reach out to the target population. क्योंकि बहुत बार क्या होता है कि जिस population को हम लोग target कर रहे हैं, basically the vulnerable sections, so these people are not as much literate and educated to avail the scheme. And why? Because they are not, the news of the scheme in itself is not reaching to their ears. And the next is strengthening infrastructure. So, improving the infrastructure, healthcare infrastructure, especially in both urban and rural areas, by increasing the number of healthcare facilities like hospitals and clinics, and also focusing on developing healthcare infrastructure in remote and undeserved regions, like ensuring equitable access to the quality healthcare, and making available or availability of medical equipments like medicines and the essential supplies in healthcare facilities. Then ensuring the quality by implementing stringent quality control measures to ensure that the healthcare services provided under the Ayushman Bharat scheme meet the required standards, and also by regularly monitor and evaluate the performance of hospitals, like by evaluating the performance of the nearby hospitals and the healthcare providers also, to maintain the high quality care. And then establishment of mechanisms for feedback and grievance redressal to address any concerns or complaints from the beneficiaries. Then the next would be capacity building. So here, investing in training programs and skill development initiatives for healthcare professionals to enhance their clinical expertise and service delivery. Also, encouragement encouragement of continuous medical education and knowledge sharing among healthcare practitioners, and also by promoting specialization in areas of high demand, such as critical care, emergency medicines, and primary healthcare. And then we have technology integration. Of course, in this digital world, we need this technological integration with the remote areas, like implementing robust health information systems and electronic medical records to like ensuring efficient data management and seamless coordination among the healthcare providers. And then we have collaboration and partnerships among, like, with private healthcare providers and pharmaceutical companies and non-profit organizations to expand the horizon, expand the reach and impact of Ayushman Bharat scheme. And then we have continuous evaluation and improvement, which is genuinely required to conduct regular evaluation and assessment to monitor the effectiveness and impact of Ayushman Bharat scheme. So, by implementing these steps, the Ayushman Bharat scheme can be strengthened and ensuring better healthcare access, improved quality of care, and enhanced health outcome for the people of India. So here I have just given one question from the previous year that UPSC has asked, just to give you an idea that what kind of question that we can get from a government scheme. So this is a scheme related to, effective implementation, to ensure effective implementation of policies addressing water, sanitation, and hygiene needs. The identification of beneficiary segment is to be synchronized with the anticipated outcomes. Here you have to examine the statement in the context of the WASH scheme. So यहाँ पे बोल रहा है कि effective implementation of policies, ठीक है, जो addressing water, sanitation, and hygiene needs. So identification of beneficiaries is to be synchronized with the anticipated outcomes. So in case of Ayushman Bharat scheme, हम लोगों ने देखा था कि वहाँ पर भी एक targeted section of society है जहाँ पर इस स्कीम को पहुंचाया, एक टारगेट बेसिस पे पहुंचाया जाना चाहता है गवर्नमेंट. तो यहाँ पर भी एक क्वेश्चन हो सकता है कि कैसे हम लोग एक टारगेटेड बेनिफिशियरीज तक इस स्कीम को और बेहतर तरीके से पहुंचाए, या फिर इसमें कोई लूप होल ना हो, कोई इन्फिल्ट्रेशन ना हो. सो examine the statement in the context of Ayushman Bharat scheme. So it can be presented in a similar manner. So yes, this was a complete discussion we all had. So thank you so much for your time and patience, and this is our website and contact. So this PDF will be uploaded on our website, and if you guys have any kind of queries or doubts, please reach out to us. So thank you so much for your time and patience.